morning and welcome. Thanks for joining this special taping of House Calls, Real Docs, Real Talk. I'm your host, Nancy J. For scheduling reasons, we're doing things a little differently today. We won't quiz you with viewer questions since this is a pre-tape show, but we will have an enlightening and very necessary conversation about reducing stroke risk for women, just in time for Mother's Day, which is this coming Sunday. As you know, women tend to postpone their own health concerns in favor of their families, but not today. So let's get started. With me this morning is Dr. Mitchell S.B. Elkind, president of the American Heart Association. He's a tenured professor of neurology and epidemiology at Columbia University and chief of the Division of Neurology Clinical Outcomes Research and Population Sciences in the Neurology Department. Welcome, Dr. Elkind. That's a mouthful. How often do you have to introduce yourself with that?
Oh, well, usually when I introduce myself, Nancy, I just say my name is Mitch, and that's good enough, I think.
I will take that.
Thanks for having me, and it's a pleasure to be here with you today.
So glad to have you here. So let's get straight to the health in the headlines as a way to kick off our conversation. Each week, we select one current headline that ties back to the topic at hand and ask our expert to respond. This week's entry comes to us from Everyday Health, and the title is grim. Black and Hispanic women have higher risk of severe stroke than white women. What accounts for this, Dr. Elkind?
Well, this report emphasizes something that we've known about for a long time, which is that Black and Hispanic or Latinos are at increased risk of stroke. And one reason for this has been thought to be the lack of access to care or health insurance that may make it harder to control risk factors and lead to an increased risk. But in this particular study, they looked at people over the age of 65, almost all of whom who had health insurance. So lack of access to care probably wasn't the major driving factor. And they also looked at not just the occurrence of stroke, which we know is increased in these groups, but also the severity of stroke. And they found that Black women and Hispanic or Latino women were at increased risk of having severe strokes. And so that's a little bit novel, and it's interesting. Not entirely clear why that's the case, but it may reflect the fact that there's an increase in high blood pressure in those groups of women. And we know that blood pressure is particularly associated with an increased risk of bleeding kinds of strokes, which are often more severe. And so that may have been part of the problem. Could also be due to the fact that many of these women may have had other illnesses, what we call comorbidities, so other diseases like diabetes and heart disease and so forth, that may have led to them having worse outcomes afterwards as well. But we can't, yeah.
No, I was just going to say, I'm sure that this study will get a lot of attention and then more studies to come from this, correct?
Absolutely, absolutely. And it's all part of a body of work that shows that women and men of certain historically marginalized groups have been at increased risk of stroke and the adverse consequences of stroke and cardiovascular disease more generally.
Well, thank goodness we are recognizing that now. So let's get into our main segment with viewer questions in You Ask, We Answer. So we pre-selected some thoughtful questions from past viewers, so let's get to them. Our first question comes to us from David in Canada. Do stroke symptoms, say the warning signs, differ for women versus men, and how might they be different?
Well, I would say that the differences between the signs of stroke in men and women are minimal. And what's most important is recognizing the major symptoms and signs of stroke. So we often think about weakness and trouble speaking. One easy way to remember these symptoms is through the acronym FAST: face drooping, arm weakness, speech difficulty. Then it's time to call 911. Those are going to be the most important symptoms. There can also be other sudden symptoms. So we like to emphasize the sudden nature of symptoms of stroke. could be sudden loss of vision, sudden severe headache, sudden loss of balance. The suddenness of those symptoms is very important. Now, there are no symptoms that are entirely unique to women. All of these symptoms occur in both groups, but some people have suggested that women may be more likely to have confusion or agitation or even hallucinations as a manifestation of stroke. They may be more likely to have nausea or vomiting or seizures, for example. But none of these things is so much more common in women than it is in men that I would put too much weight in it. It's much more important, in my opinion, to think about all of these symptoms as being key indicators that, boy, you got to get yourself to the hospital right away.
Well, here's a good question that is very female specific from Moira from Fort Smith, Arkansas. As women enter perimenopause or menopause, what should they know about their risk for stroke?
Sure. Well, certainly the risk of stroke goes up with age. So it's a little bit hard to disentangle the effects of age from the menopausal period. So we know that the risk of stroke doubles every decade after the age of 55, for example. Now, that said, there do seem to be some adverse metabolic consequences of the hormonal changes that occur at menopause. Lipid levels, cholesterol levels tend to go up at the time of menopause, and that's one of the important risk factors for stroke. There's some evidence that weight goes up, that there may be an increased risk of diabetes and other risk factors as well. So those are some changes that can occur that put people at increased risk of stroke. You know, when I was in training, we were taught that it was the fact that women had estrogen in their systems that kept the rates of heart disease and stroke lower in women until they hit menopause and the estrogen went down, and then that's when their risk essentially would catch up to men. It's probably not quite as simple as that, though. It's important, though, for people of all ages, and particularly as we all age, to be monitored for these kinds of risk factors to prevent stroke from occurring.
Well, and I'll tell you what, Dr. Elkid, I was listening to some background noise. Are you near a hospital? Are you in a hospital right now?
I am indeed, and I apologize for that. I'm not far from the emergency room, in fact, which is good for a stroke specialist, but occasionally an ambulance comes by. So sorry for that.
No, I think it adds to the ambiance. It's kind of nice, actually. So here's one from Alexis in Durango, Colorado. We kind of discussed this, but how do women's hormones impact their risk of stroke? So this would be at any age for women.
Exactly. Well, we know that certain major hormonal changes are associated with an increased risk of stroke. And what's one of the biggest examples of that, of course, is pregnancy itself, for which there is an increase in risk of stroke, but especially after delivery, what we call the postpartum period, immediately after delivery, and perhaps lasting 6 or even 12 weeks afterwards, there's a change in the body, obviously dramatically, but one of those changes is a change in the clotting system of the body. And that does lead to some increase in risk of stroke during that time. Similarly, and that is due to changes in hormones, not necessarily the absolute levels of estrogen, but the rapid shifts in estrogen and progesterone that occur during the time of delivery. We know also that some other conditions like migraine, which is really a type of vascular brain disorder, also fluctuates a lot with periods, for example. Women often get bad migraines at the time of their periods. And so that is also reflective of hormonal changes. So hormones can be associated, but usually the impact is rather modest. There's a big question, of course, about whether women going through menopause, for example, are safe to take hormone replacement therapy, and that's a controversial issue.
Well, and I had never heard about the pregnancy connection to strokes. Is that relatively new or just kind of understated, or?
No, it's been known about for some time. I mean, the bottom line is that the risk of a stroke during pregnancy or immediately afterwards is exceedingly low. So we don't want to exaggerate the risk. But we do know that compared to women who are not pregnant, during the time of pregnancy, there's an increased risk. And as I said, especially right around delivery is when that risk is greatest because of the dramatic shifts in hormones at that time. So it's important for doctors to be aware of it. It's important for obstetricians to be aware of this risk, especially in women who may be at high risk because of blood pressure or other issues. But I don't want your listeners to think that, oh my goodness, if I get pregnant, I'm going to have a stroke. No, most pregnancies, obviously, that is not the case.
Well, then here is another question for you. And this is from Rose. What are the warning signs or complications during pregnancy or postpartum that may indicate a woman is at increased risk of stroke later in life?
Yeah, I'm really glad you asked that question. So there's been a lot of research on this area recently that has changed our way of thinking about the effect of pregnancy and its complications on later life risk. So let's start with during the pregnancy and the postpartum period. As I mentioned, there's an increased risk of stroke, okay? And then among women who have what we call pregnancy-induced hypertension or preeclampsia, the occurrence of elevated blood pressure during the pregnancy, those women are at increased risk of a stroke or other cardiovascular complication in the period of time around the delivery. And that's been something people have known about for a little while now. But what we've started to see by following some of these populations of women out longer is that people who have pregnancy-induced hypertension or preeclampsia, or even some other complications of pregnancy, like insufficiency of the placenta, for example, or abruptio placentae, when there's a rupture in the placenta. Women who have those kinds of complications of pregnancy seem to be at long-term risk of strokes and heart attacks as well.
Wow.
Why that happens is not clear. Is it something that the complication of pregnancy causes, or is it that women who have those complications have something less stable perhaps in their vascular system that also makes them more likely to have a complication later? Those are the kinds of things that we're working out. But, just like we think about diabetes or high blood pressure as a risk factor for stroke late in life, we may not need to start thinking about whether a woman had any of those complications during pregnancy as an additional risk factor.
Okay, now we're going to talk a little bit about something we've talked about in the past. Our viewers may recall we've been talking about getting back into the habit of doctor's visits. Now that COVID restrictions are loosening up, the American Heart Association does want to encourage you to stop putting off your checkups and exams. And we call our campaign, Doctor, It's Been Too Long. Full disclosure, after that segment, I started making my doctor's appointments because it had been too long. So let's get back to more questions on women's health. And here's one from Jocelyn. If I am on a birth control pill or other type of contraception, am I at an increased risk of stroke? Are there specific forms of contraception that cause a higher risk? What is the relative risk for a stroke for a woman taking oral contraceptive who is otherwise healthy? I remember years ago, doctor, birth control pills were kind of linked to all sorts of things besides just not getting pregnant.
Yeah, that's true. And I'm really glad that Jocelyn asked that question. And it is a bit of a complicated question. If you look overall on average, yes, there is some increase in risk of stroke with oral contraceptives. But things have changed a lot over the last several years, and it depends specifically on which type of oral contraceptive and the dose and so forth. So overall, at least looking at older studies, there may have been as much as a doubling of risk. The risk of stroke in a young, healthy woman who's the type of person who's going to take an oral contraceptive is so low that even doubling that risk is still a tiny, tiny number. So the risk is very, very small. Over the years, of course, there have been advances so that now we use much lower doses of estrogen, and that means a much lower risk of stroke. There's some increase in risk with estrogen as compared to progestin-only contraceptives. So avoiding the combination therapies may be of benefit. There's the fact that individual risk factors may also contribute to that. So people who have high blood pressure, diabetes, and other risk factors may be at increased risk. And there's some risk factors that in particular, we really steer women away from oral contraceptives. So for example, people who smoke should not be taking oral contraceptives because that combination increases the risk rather dramatically. Similarly, women who get migraines with aura, meaning not just the headache, but also some change in their vision or weakness or numbness and tingling when they get a migraine, they also seem to be at higher risk. And that combination of smoking, migraine with aura, and oral contraceptives is really considered a no-no and can increase the risk pretty dramatically. So those are, specific groups of people, women who should probably stay away from those therapies. Otherwise, for the vast majority of women, any increased risk is really minimal.
Okay, Stevie from Crested Butte wonders, what steps can we women take to prevent a stroke or reduce our risk? Dr. Elkin.
Well, certainly an important thing is having a doctor and getting regular checkups and being checked out. And you mentioned the importance of getting back to our doctors now. I can tell you I also checked in with my primary care doctor just recently as well. So that's a good thing to do. And what are they looking for? Well, the most important risk factor for stroke is high blood pressure. So getting your blood pressure checked is absolutely essential. And we at the American Heart Association like to think of risk factors in a nice, simple way, and that's through what we call Life's Simple 7. So there's 7 things to bear in mind. 3, know your numbers, 3 important numbers, 3 behaviors, and then quitting smoking. So the numbers, 3 numbers to know are your blood pressure, your cholesterol, and your blood sugar, making sure those are under control and discussing them with your doctor. 3 behaviors: exercise, of course. So we say 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise every week. So figure 30 minutes of exercise 5 days a week. Maintaining a healthy weight and eating a healthy diet are all 3 important things to do for behaviors. And then, as I said, smoking, a definite no-no, stay away from that. Those are 7 things, Life Simple 7, to keep yourself from having a stroke.
Such good questions from our viewers and, of course, excellent answers. So let's just take a couple more. Sarah in Battle Creek asks, for women who have already had a stroke, what can they do to prevent another one?
Absolutely. Another terrific question. And certainly the things we just mentioned, so Life Simple 7, maintaining control over risk factors. But when I, as a neurologist, see a patient with a stroke, I think about not only the risk factors that they have, but what was the proximate cause of that stroke. Sometimes we can find one, about 30% of the time we can't. But we look for things like a specific heart condition. In elderly women, something called atrial fibrillation, an irregular heart rhythm, is very common. And when we find that, we know that being on a strong blood thinner can prevent another stroke. In some people, we may find a blockage in one of the arteries that goes to the brain, the carotid arteries in particular. In those cases, we know that opening the artery up, either surgically or with a stent, for example, can reduce the risk of another stroke. There are about 1,000 different causes of stroke, which is why it's so important to be evaluated, find out the cause of the stroke, and then from there we can prevent another one.
Well, so if you do have a stroke, it's not the end of the world.
Absolutely not. Strokes are preventable, treatable, and beatable, right? So many people recover. Many of my patients are completely normal after a stroke. It really depends on the size and the severity of the stroke, where in the brain it's located. Neurologists are like real estate agents, where we talk all about location, location, location. It depends where the stroke occurs in the brain. So there's a lot of variability among stroke patients, but definitely can recover from a stroke.
So our final question for today comes from a viewer in Hawaii. Nichelle wonders, are there disparities that women face related to stroke rehabilitation and recovery? How can a woman overcome these disparities?
Yeah, so Michelle, that's a challenging question, and I think brings up the point that we really need to do a better job of providing healthcare for all of our citizens, both women and men, and particularly people from, as I said, historically marginalized communities like the Black, Indigenous, and Hispanic Latino community as well. So certainly advocate for yourself is very important. But I would say also advocating for healthcare that's accessible to all, that's adequate and affordable is really what we need nationally to try to make some changes in this area. And hopefully then we can all have access to healthcare that will keep us all healthy and well.
Okay, time to take a refresher test on what we've learned about stroke. Cue triple trivia. Now, Triple Trivia is sponsored by Crazy Cool Science, our new social media campaign that pumps up the fun in science. Science is everywhere, and Crazy Cool Science proves it. And we've got 3 trivia questions lined up to test your scientific knowledge. And here is the first one. According to the CDC, about how many people in the U.S. have a stroke each year? A, 150,000, B, 275,000, C, 795,000, D, 1.2 million. I can't answer this, doctor. I don't know.
Well, would you like me to provide the answer?
Well, I guess I'm just kind of wondering, let's, I mean, 275 sounds too low. A million seems too high. So I'm going to go with C, perhaps.
That's exactly right. Yeah, there's about 800,000 strokes a year in the United States.
And apparently, about 610 of those are first or new strokes. Is that right?
That's right. That's right. So about 3/4 or so are going to be an initial stroke. And then some people, of course, have recurrent strokes, which is so challenging because the outcome after a second stroke is even worse than after a single stroke. So prevention is key.
Okay, and about 87% of all strokes, I'm seeing the ischemic, is that right? Ischemic strokes, is that how you say it?
We say ischemic stroke. That's right.
Now, yeah. And what is that?
So there are 2 major kinds of stroke. Ischemic, as you mentioned, which means a blockage in a blood vessel, like a blood clot that blocks the blood vessels so blood can't flow to the brain, the most common type. And then the other type is the bleeding kind of stroke, or a hemorrhagic stroke.
Okay, well, then I will remember those terms for sure. Our next question is, it's going to be a fast one. The acronym FAST stands for what stroke warning signs? Okay, we've got feet swelling, abdomen weakness, sore throat, time to run. Thinking maybe not time to run. How about B, face drooping, arm weakness, speech, time to call 911. Fuzzy vision, aching, standing difficulty, time to sit down is C, and none of the above is D. But if I recall correctly, you mentioned the answer to this for FAST. What does that stand for, doctor?
I did. I guess I gave it away. Sorry about that. But it's important for people to hear it over and over again. So the correct answer is B, face drooping, arm weakness, speech difficulty, either understanding or producing speech. Then it is T, time to call 911.
I also heard if you ask someone, if they're doing that to smile, that's a really good way to find out if half of their face has frozen, right?
That's right. So you can see face weakness when you ask somebody to smile. Exactly. If you see it drooping on one side or not elevating, that could be a sign of trouble.
Just call 911, as we have been hearing people in New York City calling 911 with those ambulances, right?
That's right.
Okay, so last trivia question for the day. True or false? Men and women experience stroke about the same. I remember you saying a little bit about this too, but so is it they experience about the same, but it doesn't kill men as often as it kills women? Is that it?
Yeah, I would say again, I like to emphasize that Some strokes may be a little bit different in women than they are in men, but I think most important is recognizing a stroke to begin with. What I will say, one thing that does happen sometimes is that among women who present with the same symptoms, they may not get taken as seriously by a doctor or other healthcare provider sometimes. So their symptoms may be attributed to a migraine, for example, or perhaps to, they're having their period, something like that, especially milder symptoms. A severe stroke, it's usually pretty clear. But, if somebody has a severe headache or some tingling, it may get written off among women compared to men. So that's how I see the difference playing out for the most part.
But is it true that 1 in 5 women will have a stroke? I mean, that's 20% of women.
Yeah, the lifetime risk of stroke is as high as 25% looking worldwide. It's an extremely common problem. Women tend to have more strokes, but women also live longer. They live to the older ages at which strokes occur also.
Kind of good news, bad news.
Exactly.
But of course, it's also important to get lots of rest. We've talked about food and being physically active, and don't smoke. Is any one of those more important than the next?
They are all important. I think getting physical activity is super important because not only it has benefits in so many different ways. It controls the blood pressure, the blood sugar, the weight, makes you feel good emotionally, psychologically. It helps with sleep. So I really am a big fan of exercise as a way to prevent stroke.
Well, that's an easy one. Just get off the couch, right? Quit watching TV.
That's exactly right. And it's interesting that you put it that way because some people think you have to, run a marathon or swim several miles a day or something like that to claim, physical activity. But that's not the case. We know that, especially in older people, walking, a good brisk walk, for 30 minutes a day is really a great way to prevent stroke. And the incremental benefit from going to that to, running 5 miles is minimal. So the biggest impact is, just as you said, getting off the couch, avoiding the sedentary behavior and being active rather than, any kind of extreme physical activity. That's just not needed.
Well, I will share, my mother had a stroke at 65, some subsequent TMIs, and lived another 25 years.
Mm-hmm.
So, I mean, she had good doctors and listened to me pounding her to do the right thing. So, Dr. Elkin, thank you so much for your time and advice. It's been such a pleasure talking to you, meeting you. There's so much, I wish I'd known more about stroke 30 years ago when my mother had her strokes. But anyway, I feel honored to be able to host this show because it's such a learning experience. Is there anything else you'd like to add before leaving us today, Dr. Elkin?
I'll just repeat that stroke is preventable, treatable, and beatable. And one thing we didn't talk about too much today is how important it is to get to the hospital. We talked about the warning signs and fast and the importance of calling 911. But the reason is because these days we can actually remove blood clots from the brain in people having an ischemic stroke. So, in the old days, we thought stroke was something that just happened like a bolt out of blue, a stroke of lightning, and the damage was done. Now we know that's not the case. Stroke evolves over minutes, hours, sometimes even days. So get to the hospital right away. We do have treatments that can reverse the damage. And obviously, that's the goal, is to keep people from becoming disabled after they have a stroke.
Okay, well, thank you so much again, Dr. Elkin. And that does it for our show today. You can find any of our previous shows at heart.org/housecalls. I'm going to see you next week, of course, and we are going to discuss hypertension. Oh, something else that has been running in my family. So until then, take care of yourselves and happy Mother's Day.
Next on At the Heart of It with Nancy Brown. Connecting people, policy, and politics. Congresswoman Joyce Beatty shares her heart, mind, and life after stroke with CEO Nancy Brown.
It's easy to find fault. It's harder to find an answer or resolve. So if you're finding fault with something, think about a suggestion or an answer you can give with it.
Discover how Congresswoman Beatty made impactful change in her community next at the Heart of It.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.